Welcome everyone, and thank you for joining us for the Joint Use Agreement webinar. We're going to get started for the day. So today we have three presenters. My name is Allison Lipsett-Simpson, and I'm the Education Program Associate here at Penn State Hershey Pro Wellness Center. I'm joined by special guests Manel Kappagoda from ChangeLab Solutions in Oakland, California, and Annie Clark from Lincoln Charter School in York, PA. This webinar would not be possible without the support of our funders. Funding was provided by the Pennsylvania Department of Health through the State Public Health Actions to Prevent and Control Diabetes, Heart Disease, Obesity, and Associated Risk Factors and Promote School Health Federal Grant and Preventative Health and Health Services Block Grant from the Centers for Disease Control and Prevention. We'd like to give a special thanks to our partners at the Pennsylvania Department of Health for their contributions to this webinar. A few housekeeping points. All participants' phones and microphones have been muted to ensure that information shared by all presenters can be clearly heard. If you would like to submit a question or a comment for the question and answer session, you can enter that into the question box. We will reserve time at the end of the webinar to submit questions and answer questions. This webinar is being recorded, and a link to the recording and handouts will be emailed following the webinar. A link to a certificate of completion and a follow-up survey will also be included in this email. So today we have a really exciting agenda. The key items that we will cover during today's session will include an overview of the Pro Wellness Center. We'll talk about what joint use agreements are, their benefits and challenges, key points to think about when developing a joint use agreement, and successful joint use agreement projects from Lincoln Charter School. At the end of this webinar, attendees should be able to understand the types of agreements available, recognize key steps in developing joint use agreements, and identify resources related to joint use agreement creation. A bit of information about the center. Here at the Penn State Hershey Pro Wellness Center, we are committed to educating and inspiring youth and their families to eat well, engage in regular physical activity, and become champions for bringing healthy choices to life. The vision of our center is to reduce the incidence rate of childhood obesity. We aim to be the trusted resource for educational programming, collaborative partnerships, and proven interventions in schools, communities, and like-minded organizations. In 2014, we worked with over 400 schools in some capacity, and we pride ourselves on being a great resource for schools and their partners. The PRO in our name stands for Prevention, Research, and Outreach. Examples of resources based on this acronym and our work can be found on our website. Our website has many resources, including the opportunity to sign up your school or community-based organization to be a Healthy Champion. Additionally, our Healthy Champions program is available for schools and community-based organizations in Pennsylvania and includes resources like event planning guides and promotional templates, customized school champion reports, future funding priority, and Hershey Bears incentives. To register as a Healthy Champion, visit pennstatehhershey.org/prowellness/champs. Annual registration is required to receive your welcome kit at the beginning of each school year. Registration for the 2015-2016 school year will open in April. Your Healthy Champion welcome kit will include posters for our 4 signature events, which include Apple Crunch and Walk To or At School Day in October, Go for the Greens in March, and Move It Outside Day in May. So let's get started with our speaker from ChangeLab Solutions. Manel Kappagoda is the Program Director and Senior Staff Attorney at ChangeLab Solutions, where she helps communities to tackle the obesity epidemic using policy interventions. From its inception in 2007 until 2014, she managed the National Policy and Legal Analysis Network to Prevent Childhood Obesity, NPLAN, a national program that is housed at ChangeLab Solutions and funded by the Robert Wood Johnson Foundation. Prior to joining ChangeLab Solutions, she worked for many years at the East Bay Community Law Center in Berkeley, California, as an attorney in the health law practice. She also worked for the San Francisco Department of Public Health as a senior health program planner. Manel graduated from the University of California Hastings College of Law and received her MPH from the University of California, Berkeley. Thank you for being with us, Manel. I will now turn the presentation over to you.
Great, thank you, Allie, and thanks everyone. I'm so happy to be here today to do this presentation. I hope that everybody listening is having a good day and is not too cold. We keep hearing about terrible harsh weather on the East Coast out here in California, so I hope everybody's warm and not too cold. As Ali said, I work at ChangeLab Solutions in Oakland, California. We're a national nonprofit that provides legal and policy technical assistance to communities. We focus on tobacco control, obesity prevention, healthy land use planning, healthy housing, and chronic disease prevention broadly. Ali, I am having a little trouble moving the slides.
Let me see if I can fix that for you.
Okay, but so whenever
okay, go ahead and try now.
Let's see. Sorry, folks. I'm still having trouble, but if you can move it to the next slide, that would be great. We research legal and policy questions, draft policy language, and train community leaders to put these ideas to work. And we have a really great interdisciplinary team of lawyers and urban planners and public policy folks and public health folks working together with state and local leaders. And we focus particularly on improving health in underserved communities. Next slide, please, Ali. Because I'm a lawyer and I'm going to touch very briefly on the concept of liability today, I'm going to throw out this disclaimer. Information that I talk about today is legal information, but not legal advice. Next slide, please, Ali. Today, we are talking about the concept of shared use. So what is it? Well, we define it as a concept that provides access to safe, affordable, and convenient recreational facilities. It occurs when government entities or nonprofit organizations agree to open or broaden access to facilities for community use. And the concept of shared use, this broadening of access to public facilities, has many different applications. Folks on the call may be using the concept of shared use to open up kitchens or open up libraries, but today we're going to focus on opening up school grounds for physical activity. Shared use agreements are also called joint use agreements. The public health community and its funders has started to use the term shared use, but local governments tend to use the term joint use, and they're essentially the same thing. Next slide. The goal of shared use in this context is to get from here, which is a locked facility such as a playground or a gymnasium, next slide, to here, which is an open facility that community members can use. Next slide. This image sort of lays out why the connection between obesity, physical activity, and shared use. Nationwide, only about 40% of the population lives within 1/2 mile of a park. Park proximity, as I'm sure many folks know or can intuit, is associated with higher levels of park use and physical activity among a variety of populations, but particularly among young people. Additionally, having more parks and more park area within a community is associated with higher physical activity levels, which makes sense. School grounds and facilities, which like parks are public assets, can serve as park and rec facilities when school is not in session. And so it's this concept that has made shared use between cities and counties and schools such an appealing strategy nationwide. Next slide. Access to recreational resources is not equally or equitably distributed. Low-income communities and communities of color who are at greater risk for obesity and diabetes consistently also have the fewest resources for physical activity. They live in areas with far fewer parks and open spaces and rec facilities. Nationwide, predominantly non-white and lower income neighborhoods are twice as likely as predominantly higher income white neighborhoods to have no facilities at all for physical activity. And those rec facilities that are available may be inaccessible because they are of low quality, are poorly maintained, or are unsafe because of violence or criminal activity. And again, I'm sure I'm telling folks things that they know. Next slide, please. Many children and families do not have safe, accessible, and affordable places to play. We know that people who live within 1 mile of a park are more than 4 times as likely to visit the park once a week than people who live further away from parks. And in particular, there's an unmet demand for safe playgrounds in inner cities. When a schoolyard in New Orleans remained open and supervised after school and on weekends, the number of children who were outside and active in the intervention neighborhood and schoolyard was 85% higher than in a comparison neighborhood with an older playground that did not have ongoing adult supervision. Children in the intervention neighborhood also reported reduced time spent watching television or playing video games relative to children in the comparison community. And this is from a 2007 study published in the American Journal of Public Health. And when people don't have access to or can't get to places to be physically active, they don't get enough physical activity. Common sense tells us this, and research backs it up. And I spent just a few minutes there talking about the research because I think for folks that are trying to make the case for shared use and joint use, it's good to know that there is research that sort of supports and helps to make the case. The last slide in my presentation is a list of resources that I think are particularly helpful. And one of those is a link to Active Living Research, which is a national research program funded by the Robert Wood Johnson Foundation that focuses on funding and disseminating research related to active living, and it has a lot of resources and research about shared use. So I just want to flag that for folks. Next slide, please, Allie. All right, now we're going to get into the meat of shared use. These are the elements of a typical shared use agreement. It's a partnership between a school district and the city or county to open up school district facilities during non-school hours for recreation and physical activity. And usually there's a signed contract. Shared use makes a lot of sense. Most communities have limited resources and limited park space, so instead of spending millions of dollars of public money to build a new park, communities can maximize the use of school facilities. The cost of appropriate insurance coverage, staffing, and maintenance is generally less to the city or county than building a new facility. Next slide. How does shared use happen? We tend to break it down into 3 categories. The first way is what this picture shows. It's totally informal, there's no agreement, and it might be that kids just hop over the locked schoolyard fence on the weekend. Next slide, Allie. The second way shared use can happen is because of an informal agreement or policy. So nothing is written down, but there may be a handshake agreement or verbal permission for the community to use the space. Next slide, Allie. And finally, shared use can happen pursuant to a formal written agreement or policy. So this might be called a community use of facilities policy or agreement, a use permit, a joint use agreement, or an MOU. And while all of these different types of shared use work in different communities, we like to encourage written agreements or policies, partly because we're lawyers and we like things in writing, but also because formal written agreements and policies have real benefits. They can help to set clear expectations and ensure shared understanding about community use. They can also help to make shared use sustainable over the long term so that it can outlast changes in personnel or priorities. And I apologize if my voice sounds a little scratchy. I have a cold today, so my voice is a little huskier than it would normally be. Next slide, Allie. I want to just highlight this great example from North Carolina. So some communities have embraced shared use as a way of doing business across multiple agencies that touch on facilities projects within a city or a county. And Charlotte-Mecklenburg is probably the best and most robust example of this. The Charlotte-Mecklenburg region of North Carolina got multiple government entities to set up a joint use task force in 1995, and it's still in existence almost 20 years later. The agencies included the Charlotte City Council, the Mecklenburg County Commission, and the Charlotte-Mecklenburg Board of Education. The task force has been run for many years, possibly since its inception, by a lead planner, urban planner called Jonathan Wells, who works for the county. It meets monthly, identifies potential opportunities for joint use, development, operation, or occupancy of capital facilities to achieve maximum public benefit at minimum public cost. This collaborative facilities planning and development, according to Mr. Wells, has resulted in countless numbers of projects developed throughout the community with a variety of uses and users. And I flagged this for folks. There's also a link to the Charlotte-Mecklenburg Joint Use Task Force on the last slide of my PowerPoint deck. It's worth going to their site. It's not a super robust site, but it's just a great example of how joint use can really maximize public benefit at minimum public cost. Next slide. So we see 4 broad types of shared use agreements between school districts and other agencies. The first, the simplest, is just unlocking the gates to outdoor rec facilities like this track in the picture to let community members use facilities during non-school hours. And this is the most common. A second type of agreement, and these kind of increase in complexity, a second type of agreement is one that opens access not only to outdoor but also to indoor facilities such as gymnasiums and swimming pools. A third type of agreement is with nonprofit organizations involved in developing rec opportunities for adults and youth. The YMCA and the Boys and Girls Club frequently are great partners for joint use agreements. We do quite a lot of work with the YMCA, have a lot of expertise in joint and shared use, and again, they're just great partners. And finally, many shared use agreements are designed to allow cities and school districts reciprocal access to facilities. So, in other words, providing each partner with low cost or free access to a facility or facilities it can use. This happens a lot with new construction. By pooling financial resources, schools and cities can build better facilities and then offer each partner low or no cost use of the facilities. And that's a pretty advanced joint use type, shared use type of arrangement. That's what Charlotte-Mecklenburg is now doing so well. Next slide, Allie. Okay, so before we dig into some of the more technical aspects of shared use, I wanted to ask a question of all of you. So, which issue of the 4 listed here do you think might raise the biggest barriers to implementation of shared use agreements? And you can go ahead and plug in your answer. You can select one. The categories are funding, facilities management, liability, and lack of partnerships. And we're going to touch on all of those in the next portion of my presentation. And I think we'll take just about another 10-15 seconds or so and then close it up and see what the results are. I'm going to take this opportunity to just let folks know that we have resources on all of these topics and more related to shared use on our website. Our website is ChangeLab all one word, .org. And you can download a whole slew of materials for free. So the answers that are very interesting. Liability won by a landslide. So 53% of folks said that liability is the biggest barrier to implementation of shared use agreements. And then lack of partnerships followed and then facilities management and funding were bringing up the rear. And that definitely reflects our experience in terms of what people perceive as being the biggest barrier to shared use agreements, and the issue that we get the most questions about, liability, definitely comes out as number one. So we're going to talk more about that. Next slide. So I'm going to try and touch on these 5 common considerations: liability and insurance, funding and resources, facilities management, implementation and sustainability, and partnerships. And we'll start with, next slide, Alec, please. We'll start with liability. So the question that comes up for us the most, and typically we're hearing this question from school districts, and it's a very legitimate question for them to ask, is if property is damaged or someone is hurt or killed, will we be held responsible if that person was on our school grounds pursuant to a shared use agreement? And next slide, Allie. The answer is, first of all, we say liability risks are often exaggerated. Understandably, people are very nervous about drawing liability and drawing a lawsuit. But the answer is there's no liability, very broadly speaking, there's no liability unless someone did not act with reasonable care and that carelessness caused an injury. So the first part is really important. Someone did not act with reasonable care and that carelessness caused an injury. Next slide. We typically encourage, as this question, the question around liability is typically raised in this context by school districts, we sort of remind school districts or talk through what they're already doing, because school districts are extremely good at ensuring that their facilities are safe for their students. And there's not an expectation that they do more than they're already doing for their students when they enter into a joint use agreement. So it's important, of course, that they consider possible dangers and hazards, which is something that a school district would normally do in terms of their property. Next slide. To manage risk, it's important that they use reasonable care to protect against possible dangers and hazards, and those things might include making sure that there's appropriate notices up at a rec facility or at a playing field. Depending on the type of shared use agreement that the school enters into, they may want to use consent forms or have the other party use consent forms. Next slide. We would always require in shared use agreements that we review or talk about that all the parties involved have insurance. And so it's important to find a partner who will take on liability and or provide insurance. And this is standard practice for groups like the YMCA and the Boys and Girls Clubs, and also cities and counties that may partner with cities. One thing that I do want to flag is that just because there's no liability, it doesn't mean to say that there won't be a lawsuit. And that's not to scare people, but just to say that people can file a lawsuit without really having any basis. It hopefully means that they would not win their lawsuit, but certainly a lawsuit could be filed. So we just put that caveat in. Next slide. In addition to liability, another concern that comes up, and this is a very legitimate concern, is will shared use create new costs and burdens on, let's say, school district resources, and how are those going to be met? And this is a really important conversation to have as you're entering into a partnership, and also to think through. And there are resources to meet costs, and the kinds of costs that come up are maintenance of facilities for use during non-school hours, staffing costs, cost of staffing for scheduling how facilities are used, those are wear and tear on the building and how that's going to get, or the facility and how that's going to get paid. So there are very legitimate costs that need to be considered. Because there's so much interest in shared use, there are now foundation grants available to help get shared use partnerships off the ground. Some states have shared use programs that provide government grants. We're doing some work with faith-based communities, and there can be congregational or member support, and then of course in-kind donations and volunteers and through partnerships. Next slide, Allie. We also just want to flag the importance of thinking about implementation and sustainability when you're entering into a partnership or an initiative to move shared use agreements forward. It's really important to have buy-in from key leaders, from the staff that are going to be doing the scheduling and the maintenance of facilities, from leadership within agencies and organizations, and from any community-based organization partners that are going to be involved. It's also really important to have a point person or a champion for the effort within one or both agencies that are party to the shared use agreement. It's really important to communicate about the shared use agreement and initiative to the community so they know this is happening and you're getting positive feedback about it. And once you've managed to implement a shared use agreement or a broader initiative, it's really important to nurture those partnerships so that the initiative remains sustainable. Next slide. I'm going to talk briefly about an example from the Coachella Valley in Southern California. Last year, I did some work on a shared use project in Coachella Valley, and two funders, the California Endowment and the Desert Healthcare Foundation, had come together to increase access to recreational facilities for underserved parts of the community. It was a great project. These funders were really supportive, which often with shared use initiatives, the will is there in the community, but there's not the funding to support it. But this was the other way around. There were two funders that were really excited about it. They started by asking me to conduct an audit of the existing school board policies and kind of get a lay of the land for shared use agreements. And then they wanted to get shared use pilot projects in areas that lacked parks and community centers. So the first part was easy, doing the research, but we ran into trouble because there wasn't buy-in from the school districts. There were a number of different school districts, and from the cities where the partnerships would have to happen to move shared use forward. There was a lot of enthusiasm for this effort from the foundations, and there was funding for the effort, but there were not champions within the school district and within the city governments. And so the effort, it was really hard to get any traction. And we also didn't have kind of authentic community-based support, and that made it very challenging as well. So where we are at the moment with that project is the foundations have not given up on the effort, but they've gone back. They're doing one-on-one education with key agency staff to lay the groundwork, and then they're going to move forward with their pilot projects. Next slide. I want to just touch on the importance of facilities management in the context of shared use agreements. It's really important to be aware of the fact that staff are going to be needed to manage a facility schedule, keep the facilities clean and well maintained, and lock up the facility. And we found that in some cases when you're embarking on a shared use effort, it can be really helpful to talk to the unions that work with maintenance workers and the custodians to make sure that they're on board with the idea of a facility having extended hours before you get too far down the road. So I just wanted to flag that. Next slide. So I've touched on a lot of different topics very, very quickly. I want to highlight that we have what we call our National Joint Use Shared Use Toolkit called Playing Smart on our website. It has a lot of case studies in it in addition to a much more in-depth analysis of the 5 topics that I've touched on today. Next slide. Ali asked me, as I was when I was wrapping up the presentation today, to just leave folks with kind of an action item. And so I want to highlight one other resource for you on our website. It's called our Checklist for Developing a Joint Use Agreement. And it runs through things like, it runs through the key issues that we think folks or collaboratives need to think about when they're embarking on a shared use initiative. The kinds of things it lists out are identify community and school needs, obtain approval from governing entities, select negotiators, work with risk management and legal counsel. And we think that a good place to start in terms of moving your work forward may be to pick 2 or 3 things on this checklist and use it as a way to get started, or you can use the checklist to help a collaborative prioritize the steps that they want to move forward on. Next slide. I mentioned earlier that this slide has some helpful links and tools for all of you. I touched on most of them, but I want to highlight the School Facilities Cost Calculator. This is a resource that has been developed by the UC Berkeley Center for Cities and Schools. And if one of the barriers that you're coming up against is that it's hard for the parties to establish how much it's going to cost to open up a school playground or a school facility, the cost calculator can help both parties to an agreement come up with a number that then can be used as part of the negotiations for a joint use agreement. It's you do need to have some data about the size of the facility, etc., but it's very easy to use and user-friendly. Next slide. So I will end there. I know that we're going to have time for questions, and I thank you very much for your attention, and I'm looking forward to questions later on. Thank you, Ali.
Thank you, Manel. That was really great information, and I know hopefully most everybody on here has taken something away. So thank you for being with us. I would like to now introduce Annie Clark, who will share with us some examples of the impact that joint use agreements can have on schools in the community. Annie is the Community Outreach Specialist at Lincoln Charter Schools, and the mission that she lives by is to improve the lives of children who attend these schools and beyond. As a mother of 4 and a yaya of 2 grandchildren, this mission falls incredibly close to home. She has traveled across the United States and collected ideas and motivation to improve the York community, where she has lived her entire life. She has completed a bachelor's degree in organizational psychology, a master's degree in elementary education, and is currently working on her doctoral degree in an educational leadership program. Annie currently serves on the Pennsylvania Department of Education's SPAC Council. She is the advisor to the Lincoln Charter Schools Parent Advisory Council for both campuses. She is the board secretary for the Centro Hispanic Jose Hernandez Center. She's the executive director for the Hope Street Garden and Learning Lab Incorporation and is a member of the Eat, Play, Breathe Committee. Thank you for being with us, Annie. I will now try to pass the presentation over to you, and let me get you on here. And you, Annie, should be ready to go to click with your mouse. So thank you for joining us, Annie.
Thank you for having me, and I'm looking forward to talking about all the great things that we've done at Lincoln Charter School. So Lincoln Charter School was established 15 years ago, and we are the first and only conversion school in the state of Pennsylvania. So that in itself made it unique. That for a long time we didn't have partnerships, that really we were sort of like operating as an island. Ali, could you switch to the next slide for me? So in the beginning, our joint use agreements were pretty simple. Basically, we were looking for anybody, really anybody, to partner with us. And it started out with the Boy Scouts, which were one of our original partners. And that affected just the boys. And every Wednesday they would come in, and about 100 students would participate. And it's still a really large program. Now they've sort of come along and met our needs, where now, because we're doing some different after-school programming, they're actually doing Boy Scouts with boys and girls, just because that partnership has grown into, that they're meeting our needs. At first, we were just meeting their needs by giving them a place to meet. Your local boys clubs are always in need for gyms because they have a lot of basketball programs, cheerleading programs, and the YM partnered with us early on and gave us some advisement of what before and after school would look like in a school setting, but they weren't able to put their programming in. Next slide. And then we started to think beyond the gates. After about 7 years of working alone, the situation sort of changed, and that we realized that we really needed more partnerships. So one of the things that we developed within the school is that all urban schools are Title I. Most are Title I, and they take additional funding to improve reading and math. But with that, they also agree that they will give a place for the parents to really be advising the school, and these are called parent advisory councils. They're different than a PTO or a PTA, where in fact the school is to train them to be advocates for their child and for all children, and then they actually direct what the school should be putting their energy into. And that's really what our PAC did. So early on, one of the needs was a playground because we just had macadam at our building. And so the children were getting injured a lot because they were just running back and forth and back and forth. A friend of mine had heard about the fact that the parents really wanted a playground. He was working for Amerihouse Mercy Foundation. They were building playgrounds in Philadelphia, and then they decided that they wanted to expand, and they were originally looking at Harrisburg. But in fact, just because I had kept saying that we needed a playground, that my friend said, why don't you come to York, Pennsylvania and meet my friend? And so they did do that, but it took us about 1.5 years to really come up with an agreement on building the playground. And then one of our other key stakeholders in our community is the Salem Square Community Association, and they are actually like the neighborhood association, but they've gone further where they're really a model. When you put a school together along with a community group, along with a funding source, they were able to actually put new street lights in, put new gate projects in, so it actually improved all the area around the school. And we are a true urban area. We are a high crime area, so any improvement around the school makes the school itself safer. Next slide, please. We decided to start to actually build in the community. So the first thing we built was the playground itself with the help of Amerihouse Mercy, and with that came about 50 new partners. Everybody wanted to be involved in building the playground at Lincoln Charter School. But with that, people started asking us to look at building more things, and one of the things was an outdoor garden. Now this actually involved our redevelopment authority, which most communities have an RDA. When people abandon properties or houses burn down and then those properties, that land becomes abandoned, the city itself takes over those green spaces or those abandoned buildings and maintains them. In our local area, there's about 320 RDA properties that our city takes over, and almost 290 of those are green space. And so these can be used for pocket parks, they can be used for gardens, they can be used for just areas that students can sit or adults can sit. But we decided to actually build the first of its kind outdoor learning lab. And it's interesting that the other speakers from California, because I traveled there about 3 years ago, and I was fascinated by the outdoor classrooms. Because the weather's warm, every school had an outdoor pavilion or an outdoor area that students could, eat or learn. And one of the first things I said when I came back was, we need an outdoor school, and my principal was like, where would you put it? Luckily, our friends from the RDA were impressed that we were able to build a playground and that we opened that playground up to the local community. So everyone in our community is allowed to use our playground after school to about 9 p.m. every evening. And then we open up the gates also on Saturday and Sunday. And I do agree that what the park builders said to us, or the playground builders said to us, was that we could have just as much liability by locking the gates as if we leave the gates open. And so we in fact did that. We left the gates open, and we haven't had any injury, or we haven't had any incident, and that was in September 2012 that the playground was built. So then we built Hope Street Garden. It's a 1-acre piece of land within the city. It's a very large space for city. It's green space, and what we did was built 10 beds, 10 by 40 feet in the center of that. We produce about 1,000 pounds of food a year, and that food goes directly to our students who participate in our entrepreneur program in the summer with about 30 different partners. And I didn't list them on here, but I should have, because we have this great entrepreneur program that we have matched up each grade with a local church or business, and we build or grow something different in each one of those grades. And then the students go actually down to our local market and have an entrepreneur sale. And last year they raised about $500, and they were able to keep that money, which was pretty awesome. And then in addition to that, Hope Street building that, and this picture here shows us with our mayor and, of course, our state representative, Kevin Schreiber, and our students from Lincoln here and from the surrounding community. We helped our parents build mini hopes. So one of the things that we had found out through this process of building a garden is that parents could use their food stamps to purchase either plants or seeds. And so we actually had, after the very first year of Hope Street, 5 parents build their own gardens. And so this was when we really realized how quickly we could affect change in our own community, which was exciting. Next slide, please. So now what we've really done is brought this joint use actually within the school. So we're allowing other organizations now to bring their curriculum into the traditional school day. Now, I don't know how other schools feel about that, but for us, what we have realized is that when we were public school, our achievement was very low. It was about 8% in reading and 6% in math. And then we became charter, and we went to about 50% reading proficiency, about 70% in math, which is much better than where we were, but we've plateaued. And our teachers, we feel, are working very hard, as hard as they can to do great student achievement. But we realize that at this point we need help. We need more and different approaches to education to come in the building. Thank you. Sorry about that. That's our intercom. So we've added the 4-H curriculum into the school, and our 4-H liaison comes into the building all day on Monday, and she teaches in 6 different classrooms and then runs a program after school, and they're actually using their curriculum. We also have a program with the Vegetation Education, adorable program. It takes fresh vegetables and makes these little salads from it, and every tool that the students use is, child-friendly, from the measuring cups to the plastic knives that are used, which has been really neat to see that. We also had a huge need for food. I know that a lot of areas have childhood obesity, but I feel like in our particular area that we have actually the opposite, that a lot of our students are malnutrition because they are not getting the right amounts of fresh fruits, vegetables, dairy. And so for us, of course, all of our students were getting free breakfast and lunch because we're 100% free school for breakfast and lunch. But after the students were leaving, they weren't having anything to eat. And so one of the things we did, and this came from our summer work program, was we started by having summer lunches. And then that grew into actually having a dinner program. So every night the children can come here from 4:45 to 5:30 and have a hot meal. And then in addition to that, just recently we've been able to add the snack program into our school that at 2 o'clock, snacks come for all 800 students, which is outstanding. So our students have the opportunity to eat 4 times a day at our school, which has, I believe, made a huge difference. We're going to see what that does actually to achievement here in the next couple weeks. But these are all programs. Our lunch program, our lunch and breakfast program are ran actually through our school, but our snack program and our dinner program and our summer lunch program actually come from a church, and that's another joint use agreement that they agree to be our provider. They bring all the food, they staff all the people, and that's created 20 new jobs in our local community within our neighborhood here in the West End. And then what we agree to is that we will provide the students and the supervision and the facility to feed the children, that we will also be a local drop-in center. So any child between the ages of 5 and 18 years old can eat here every day, even if they don't go to school here. And I'm really proud of that we've expanded. Our programs are, originally for children of Lincoln, but they also are used by children outside of our school, which I really appreciate that. Next slide. And so now we're at the questions, and I'll turn it back over to Allie.
Thank you so much, Annie. We do have a couple of questions, and actually, Annie, I'm going to send you the very first one because I think you'll be able to speak to this. The question is, how do we keep wellness initiatives a priority in the face of many competing demands and goals to reach? So how have you been able to keep these wellness initiatives a priority?
Well, I think that's absolutely a great question. And at first, when we had our first policy that came down about snack foods, I was not a fan. I really was not a fan. I thought, how are we hurting students by letting them have cupcakes once in a while? I simplified it to that. But really what changed my mind is when I really started to do the work on the playground, and then I really started to have to sit down with experts. So I think that really being knowledgeable about the fact that our children, that there's really a huge health disparity. And I think speak your purpose all the time. If somebody had told me 5 years ago that most of my conversation would be around health equity and how to make our community healthier, I would have not agreed with that because I didn't have any medical background. But the truth is that education schools are the best place for these programs to go in because they're proactive. It's actually preventing childhood obesity. It's preventing heart disease. It's preventing all these things. And by identifying your problems, know your community, and you have to have sort of I really am the face of our schools, the voice of our schools. I'm true and authentic to the community. So people, when I say something, I mean it, and they know to listen, and they know that I'll get the job done. So I think do really good work, and if you do really good work, then people will listen to you, and they'll always, people will just start coming to you and offering you programs, and that happens to me a lot.
Thank you, Annie. That's great. Manel, do you have some other additional thoughts on that question that you might be able to answer about how to keep wellness initiatives a priority in the face of competing demands?
I'll make two points. So first of all, when I talked about the Coachella Valley example, what that was definitely missing was an Annie. We needed a champion, just as she said, to keep the issue as a priority and to push it forward in the community. And if you don't have that, it's really hard to move the work forward. The second point that I'll make is we are trying to frame. Certainly, our focus is health and health equity and health disparities. That's our focus, but we also are trying to make complementary arguments about the economic benefits of the kind of work that we're doing. So just as Annie just talked about how this work is prevention and is preventing future problems, we're trying as much as we can, and along with many, many other people and groups, to try and quantify what that actually means for businesses, for cities, for communities, because it is a health issue, but it's also an economic issue, and where we can sort of lift up stories of companies that have decided not to locate in certain communities because of the health indicators in those communities. We'll do that to make the point that these types of interventions are critically important.
That's fantastic. Thank you. And I think that leads really well into the second question that we have.
Dr. Rivera, please come to the office. Dr. Rivera to the office.
And so I think the next question that came in, and I'd actually like for both of you, and Annie, if we want to start with you, actually let's start with Manel a little bit about this because I think some of your resources indicate this question. And the question was, what should you look for in a partner when thinking about creating a joint use agreement? So Manel, what are your suggestions on that?
Well, I think that there are really, what we've seen work really well is when there are actually sort of broadly three groups involved. So there's a community-based organization, group, or even an individual that is really invested in increasing access to health for their community. That, I feel like that group or person has to be involved. And then types of shared use agreements we were just talking about, you also need a school district as a partner. Typically it's the district and not just an individual school. And then you need a city or county agency, and typically for the agreements that we're looking at or working with, it's the Parks and Rec department of a city or a county that would be the other partner. So those are the actual entities that are typically involved in the agreements that we're working on. And I think that the collaboratives that have worked best are with when there are school district leaders and community and city or county agency leaders or staff typically, it's not necessarily the people at the very top, but staff that really get or are willing to learn about the health piece. And that's where advocates and others can come in and really do some great education to explain why shared use is not just a kind of it's a health issue, not just a bureaucratic and contract issue.
Great, thank you. Annie, how about you?
Well, I think one of the ways that we've drawn partnerships, and we have some unique ones. I mean, we have the obvious ones, of course, but we have so many partnerships with our government officials and also churches, which is interesting to me that we have this wide range. What we do is we try to really ask very specifically what we're trying to accomplish. Like we give a real clear message on what we're trying to accomplish. And then what we ask people is, what can you bring to this? Instead of making a list of things we want, which I think is a lot of times where people start their partnerships is, I want. What we try to say is, what can you bring? And a lot of times people will come back and say, well, what do you want? I'm saying, no, really, you know, how do you see your work fitting into what we're doing here? And 99% of the time, people can find a connection. And then what we do is allow them to bring that small piece. And so sometimes it will be the individual who brings a program, or sometimes it is, you know, like we do have a partnership with Parks and Recs, but theirs is more supplemental. Like they see that we need a need for more trash cans or more rakes, they'll bring that, where they're not really doing our programming. And I think the one unique thing about charter schools is that charter schools are their own districts, because they're not part of a district. They may sit, like we sit in York City, but we're really not part of York City, so they're their own school and district. And I would say that if somebody had a new initiative, I would actually go to the charter schools first, because they have their own board of directors. So our board of directors is really counting on my opinion or the principal's opinion on what the school needs. And so if I say that I think that we need an after-school program or a park, or, you know, we need to build something, they're very quick to listen and then quick to act. So we don't have any red tape. If I ask for it and they say yes, you know, we could be within days going from doing nothing to doing something. And you've seen some of the larger things we've done here, like we actually do the walk to school day, but we close down the entire West End and take 1,000 kids on a walk. And we've actually biked from our school the whole way to our city hall and closed down 2 main thoroughfares to be able to do that. And so those are things that involve, you know, the police, your government officials, your emergency teams, but those are things that really get the community's attention, and then all of a sudden everybody's talking about walking and everybody's talking about biking, because you have 1,000, you know, 1,500 children moving somewhere is a pretty big deal.
Thank you so much to both of you, and those were fantastic thoughts. So it looks like our questions are finished, and I just wanted to take a moment to thank everyone for joining us today, and a special thank you to Manel Kappagoda and Annie Clark for being our guest presenters on this webinar, as well as to our funders who allow us to impact health and wellness in schools and communities. As a reminder, our names are displayed on this final slide, and you can reach us at the Pro Wellness Center at hmc.psu.edu. I thank you all for helping us bring healthy choices to life in our schools and communities. So thank you very much for being with us today.
Thank you.